Good.
Oh, yeah. Oh. You know, my friend is. Most people don't, yeah. Here, Presley has.
Yeah.
Separate hills, this hill.
Megan?
South
Right.
Florida.
Okay. We got close to 40. Yeah, you're live. Lady forward. You're live.
Gary.
All right, everybody.
Gary.
As I said before, we have a presentation coming, so I have to get this meeting started because they have to leave a little before we do. So let's get this call this meeting to order. The time is 5:34, and thank you all for being here. I'd like to take just a brief moment. Whether she's your friend or not, or whether you have good memories or not, Jeannie Richardson passed away in the last 5 days. She fell into a second coma and never woke up. So we lost a member. Well, an old member, excuse me. But she passed away, and Sy would like us to have a remembrance of Mr. Kirk that got shot recently. It's a tragic event, but he's in a better place than us. So anyhow, I will pass this over to our secretary. You want to start a minute? Or
I thought we were taking a moment of silence.
okay.
Okie dokie. We have guests here from the Pinellas County Human Services Department. They're on a tight schedule and they have a presentation for us. Let's begin.
Thank you so much. I blame my children for the late skip, for the having to run out of here. So I apologize. We are very thrilled to be here and thank you so much for the time to be able to be here with you. My name is Elisa DiGregorio. I'm with Pinellas County Human Services. I am the healthcare administrator. I oversee the Pinellas County Health Program, or many know it as the Blue Card Program. Shake your heads if you're good with that. As many of you know, part of the health program includes a healthcare for the homeless program. We have the Bayside Health Clinic, the mobile medical unit, the large truck-like van. We also have a street medicine team that works out of a smaller Sprinter type van that goes around to various locations throughout the county. As you may know, we provide primary care medical services, including dental services, pharmaceutical, meds, specialty care referrals, mental health, substance use services. So it's a very comprehensive healthcare program. But most importantly, it's provided at no cost to you. No copay, no deductibles, no out-of-pocket costs for any of the services once you're enrolled in our program. We do primarily target those who are homeless, any kind of homeless, not just street homeless, shelter, transitional housing. Even if you're in a permanent supportive housing like Foley or any one of the Pinellas Hope residences, for example, even if you're on living with family or friends, those are all qualifiers for our healthcare for the homeless program. So if you have a question about that, please let us know. We have no income restraints for the healthcare for the homeless program. So again, really no barrier to getting the service if you fit any of those criteria for the program. Feel free to stop me at any time if you have a question about the services. But really, we're here to serve you. We're here to provide quality medical care to you and to really help you out. So make people stay healthy, be healthy, get healthy, handle those things that come up. And we, like I said, there's really nothing we don't provide. I mean, like I said, we have specialists, dental, all of the different services. So, but we're really here today to kind of talk to you and listen to you and hear from you about if you're familiar, find out if you're familiar with the program, if you have experienced our program, if you've been to one of the clinics or the mobile vans or worked with any one of our staff. I do want to introduce a couple of our team members. Dominique Randall is also with Pinellas County Human Services. She is one of our homeless section managers. She's an amazing resource in our community for all the different available services in our community. And then Anne Marie Hosley, she is the program manager as of tomorrow, but she has been with us as long as I've been here. So many of you may recognize her. She is the face at the Bayside Health Clinic. She is overseeing the entire program on the ground at the clinic with the staff, and she works for the Florida Department of Health. So we are hand in hand, and we've been together for quite some time. Please.
Guys, split the income with 90.
I'm sorry. Oh my.
Did I hear that right? You guys lifted the income limits and stuff for that? I have a friend who's, I wouldn't say homeless per se, but he's in a bad situation and he's been in the hospital over half a dozen times in the last year because he keeps getting edema and stuff. He has some issues and but he's got nowhere to go. He has the medicine and stuff that he needs to have. He's got nowhere to go.
Yeah, the healthcare for the homeless program does not have an income limit. So if he does qualify from any one of those types of homelessness, couch surfing, not paying rent to anyone.
Yeah, it's part of what he's having problems with right now. He actually works at Domino's there in 62nd or whatever, but they're not giving him enough. He can't even pay his rent.
So definitely have them reach out to us and let's talk through it. We do have kind of two different programs. They do the same exact thing. It's called the Pinellas County Health Program. One is healthcare for the homeless. The other is Pinellas County Health Program.
Right.
That one does have a strict limit
Right.
of the 100% of federal poverty.
Yeah, I think I was part of that one initially before I got disabled and got my card and all that stuff.
Yes, but the healthcare for the homeless program does not have that same income limit.
Okay. You guys have literature for all that stuff?
We do.
I would like some of that stuff before you leave.
Absolutely.
And everybody, the fact that our presentation has limited time with us, I'm pleased going to ask you to stick to the 2-minute rule, please. One over here.
Is there an age limit to use the facilities, the van,
Not with the healthcare for the homeless program. Again, our healthcare for the homeless program can accept anybody of any age. We don't have pediatricians, so I will say we don't really take the children, but we do take any adults at any age for our healthcare for the homeless program. Now, if you have Medicare or Medicaid, we will try to connect you to if you have a provider, we'll try to connect you to that provider that is with your health plan if you already have an insurance. But if you don't have an insurance, you're not connected to Medicare, please come see us and talk to us first so that we can assess that.
as I was at Pinellas Hub in 2023 and Safe Harbor, there were a lot of people, I'm 70, there were a lot of people that were 65 or over that they said they couldn't use those facilities.
If you have usually if you qualify for Medicare, you'll be assigned to a primary care provider. But I would always say, come talk to us and let us try to connect you so we can get you connected to care. If we can't get you connected to care and you have an issue, they should be able to triage and help you. They may not enroll you in the program because if you haven't you're already enrolled in a health program, they want you to get to that program. But we'll be here if that doesn't work, right? If that falls through or you don't have that plan. Correct me if I'm wrong on any of that.
Want to talk about the difference of the buses?
Someone else?
that we can. Any other questions before I go in?
Anyone have any questions?
Let me talk about our sites for a moment. So we have the Bayside Health Clinic, which is located next to Safe Harbor. You've probably been there. We're pretty excited right now because we've expanded and gotten new vehicles and expanded our Bayside Health Clinic. So if you haven't been there lately, we've expanded by about 2,000 square feet. We've added additional dental services. We always have dental right next to Safe Harbor.
Sure.
Yep. We also brought in our mental health provider, Direction for Living, into the Bayside Health Clinic. So you can receive your primary care service, your dental service, and your mental health services all at the Bayside Health Clinic. And then we have the two vehicles, which is the mobile medical vehicle, which is the larger van, brand new as of January. So very nice, beautiful vehicle. So if you haven't seen it yet. And if that goes each day of the week, it has an assigned location. So Monday, Tuesday, Wednesday, Thursday, Friday, it goes to a particular location. So you can find that on our website, or call and ask, where it is on that day, that particular day. The mobile medical van, the large van, has 2 exam rooms and can provide anything that they provide at the clinic for the most part on the van. So there should be no limitation in terms of the types of services for the primary care that you would get on the van. Is there anything I'm missing that you can't get on the van?
But it's just
medical. Yeah, we don't have the mental health right now with the van. But then we have the street medicine team, which is our smaller vehicle. And that is really trying to outreach into the community for those individuals who are not engaging at your clinics. They're trying to go to the park, to the libraries.
Yeah.
Yes, and they come here or anywhere that they're seeing people that might need assistance. So they're not providing maybe the full array of medical service right then and there, but they're trying to triage and treat something that's really ailing right at the moment.
One comes up at First United Methodist every Wednesday. Ruth is on the.
Yes, Ruth is with our street medicine team.
And they will help you connect with Bayside or somebody
Yes.
else. They'll even help you renew your card.
Yes, thank you very much. Yeah, we were really trying to make sure that you're getting the care and you're not lapsing. And they will help connect you to services in the community. So they're really there to help you out. And I've heard great stories. But also I know there's always issues. So, we're always open to hearing a little bit about, anything that you haven't had a good experience with, or if there's something you really wish you were getting that we're not providing. Like I said, has anybody used the dental services within, what's yours? With Jen?
Very good, yes.
Dennis, yeah, Dr. Gaten's
They're very good.
is amazing.
I've had several. Each and every one have been above and beyond.
Fantastic. Anyone else have experience with the dental program?
I've been on the Giant Plus, the big one. I started with that. I've been at Mid County and I'm still looking.
Wonderful.
I had a quick question.
Yeah.
So, I go every year to the dermatologist for a skin check and I had 26 stitches put in my nose 2 weeks ago because I had a basal cell carcinoma, which was pretty scary, but it made me think about people who are out in the elements a whole lot. Do you do those kinds of services for our unhoused and take care of that cancer treatment?
Yeah, go ahead, talk about either way.
Well, yeah, this. Our student medicine program will go, and they can refer to dermatology contractor with us. We can also, as long as it's not an urgent, like an emergent case, we can take out stitches in the clinic. So you don't have to always go back to the dermatologist.
The street medicine team also has supplies from Department of Health, things like sunscreen as available, because honestly, sunscreen, as you know, is one of those expensive and often overlooked needs for those who are on the street and in the sun. Toothbrush, toothpaste, a little bit more accessible versus sunscreen. So that is something they just got a big order in last month and have been distributing it as well.
Same for bug spray,
Bug wipes too. Has anybody had a chance to interact with any of the other providers that we work with? Directions for Living, Operation PAR, hands going up and heads shaking. Good experience, better experience could be had. Here's some.
Operation PAR is a really good program for people that want to get clean. And, they do go above and beyond. You know, that place is, I've had several people that I've known that have gone there. And, a couple have gone back twice. They've allowed them back in. But overall, that is one of the better places here that I do know of where people can get off of drugs or alcohol or maybe a combination of both. And, they address your mental health needs as you're there. If it's not safe for you to go home, or if you don't have a phone, they work on all that on the inside. So it is a very good program.
Our substance use services do include medication assisted treatment, so the service for methadone, Suboxone, and buprenorphine are all covered as part of the service provided to our clients as well. So Operation PAR does provide those services for us. Another one of the benefits of being in the program is around transportation. So we do provide the free 10-day bus pass per month to our members. And then you can upgrade to the 30-day bus pass for the $6. We also, if you have appointments with certain medical doctors, we have provided cab services to and from specific appointments. And so that's also an option when it comes to trying to work on specialist appointments or trying to get you into certain services that maybe the bus is not going to work for you as well. So just want to make sure you're aware of that particular transportation benefit as well.
I'll also mention along those lines, I think it's often forgotten is something like a major dental procedure where typically, you know, someone would be driving you or taking you back home, is that you may be able to get the bus or ride your bike there, but it may not be safest for you to ride back. So things to consider with that as well, and to advocate for yourself and for those when you guys are going for services.
Yes.
So that. So the transportation services would be for somebody like my friend who doesn't have a car and any of that kind of stuff, because he's got no way to get around anywhere.
Yeah, he would just need to, once he's enrolled in working, you work with Anne Marie's team and they'll arrange for that cab service for those appointments.
Yeah, because he really needs a doctor and help and stuff, because like I said, every time he's gone there, they've gone there, made him stable and sent him. And he's still got issues because they didn't treat him correctly.
Sure. We do try to work with our hospitals for coordination of care. So if you do get admitted or go to the ER, try to make sure you let them know you're with the Blue Card program so that they can help connect you back to the doctor so that we're not missing out on what service or medication you were prescribed at the doctor's office. So we're really trying to figure out how to work better. We know that you don't necessarily always have the card on you, or maybe if you're in the emergency room, it may not be the best condition to try to remember what your insurance or your plan is. But if you're, try to remember Blue Card, county program, that way they can help coordinate back your follow-up visit with the doctors here as well. So we do work with the hospitals for those, try to keep those care connections back too.
I would say the only good thing they did the last time is they set them up with disability stuff. They started this back.
We do have, we are able to also help with those connections on setting up for disability benefits. We also know that a lot of people have been enrolled into private health insurance plans, maybe unwillingly or unknowingly. So again, our staff can help if they identify that you've gotten Blue Cross Blue Shield somehow. And need help getting off it, we can help with that as well if that's not the right plan for you. There's been a lot of fraud in that area, especially among the vulnerable populations. And so if you find or know somebody where that has happened to them, again, reach out to the county so we can help make sure that you're getting the right connection to care for that. That reminded me as well.
Can I interject for a second?
Please.
I was involved in your system almost 2 years ago. I broke my hand 4 places, and the timely way I could get a appointment was off. It took me 3 weeks to see the doctor, and they got me a referral to a specialist. It took me 4 more weeks to get that. And when I got there, they're like, "It's an old break. There's nothing we can do." I'm like, "You think?" You know, so is there anything we can do to speed up that process when it's necessary for our well-being?
Yeah, I think we definitely can look into it and try to make those connections happen faster. You know, we do have a specialist network, so maybe if there are opportunities to get you in faster.
Yeah.
I know you can
That's necessary. It should put you ahead of mine, I think, so.
Yeah,
I can second that too, because my experience is like, it's an all day event. It's like the instructions on the back when I go about, don't make any plans. You know, I would get there at like 7:30 in the morning, I'd be there at like 2, 3 in the afternoon.
yeah, for the specialist or for the.
And for just to go see the primary doctor, you know.
I'm talking months, you know, before I can see him.
Yeah, I've had that happen too.
Yeah, thank you.
I'm bored. Gary, you said, wait, you see.
Hey guys, how you doing? My name's Dan. Nice to meet you. Thank you for coming out and sharing information on this wonderful resource pack and the great work that you guys are doing. You mentioned enrollment. Any like high level criteria just on the back of a quick piece of paper? I'm sure there's lots of detail behind it. And is it on site as well as online? Is it on site these locations as well?
Either, you could do it either. You can do it online, you can come in person. And we also have people outposted at various shelters sometimes or on the van. So really anywhere we should have somebody there to be able to assist you as far as getting enrolled. So online, telephone, coming into the office, the clinic, a shelter that has our staff there. They're all able to assist. As far as the criteria for the healthcare for the homeless program, the main criteria is you have some form of homeless experience.
Right.
Again, it's a pretty broad definition of homelessness, a little broader than some other entities define homelessness. But there's no income limit, there is no, if you're insured, we try to connect you back to that insurance plan. But if you're not insured or you're uninsured, even if you're working and have assets or income, it should not be a restriction. We are really trying to be a low barrier program, but if you do already have insurance, we will try to connect you back to that insurance provider. That will be the only.
And are there any residency stroke boundary?
No.
No, that's all. Great. Thank you so much.
Yep.
I help veterans for free when I've taken veterans to the VA. Some veterans have been fined over $100 because they did not sign up for Medicare by the time they were 65. Have you ever heard of that?
I have not heard of that.
And if that could be researched and publicized more, because like I said, I've had veterans, like, some of those programs will be at the VA, helping veterans with healthcare, and they were getting fined over $100 a month for not signing up for Medicare by the time they were 65 or 66, because they thought the VA was good enough that they didn't have to sign up for Medicare. So a lot of people don't know about that issue. And it gets
We
to
haven't
be a
heard that.
nightmare.
Yeah.
So if you could research,
We'll
what
definitely
about
ask
do
around
people need
and
to
see.
sign up for Medicare? And do people have to sign up for Medicare by the time they're a certain age?
Okay, we'll definitely look at
A
that.
veteran in South St. Pete, they're taking $100 a month out of his Medicare, and they've been doing it for about 5 years. Thank you.
Thank you. Mhm. Any other leading questions from them? I also wanted to mention, in terms of providing our services, we do offer telehealth services. So I don't know how, if you've ever used technology to do any kind of medical appointments. Have you used a patient portal before? Have you done a telehealth or telephone appointment? Zoom type appointments? Anyone else use your telephone to make connections to healthcare yet? It's something of it. We do have the telehealth piece. So if you we can help you get set up on it or learn how to use it if that's something that makes it easier for you to get care as well.
Directions like that for patients.
Directions also does that for patients, yes.
The only thing I'll mention about telehealth is that you cannot do your initial appointment, your establishing care appointment on telehealth, but you can do follow-up.
The other thing I wanted to ask is, I guess, where else do you go for care? So we know that you may go to an emergency room, obviously, or a hospital situation, but there are other providers in our community. There are free clinics, there's Evra Health, probably some other folks that are providing care. And we just wanted to talk about a little bit about your experience with that and doing that. And then how that might affect if you are enrolled in our Blue Card program, because again, you know, if you're enrolled in our program and your primary care doctor is through the Department of Health, all of those services are going to be free, right? So, but if you go to another provider in the community, their policy may be different. So, and then you might get prescribed a medication by that provider, and you might get prescribed a medication from our provider, and we don't know how to work, you know, how to work and know about that, right? To coordinate. So, I mean, or have you gone to some of these other locations, gotten services from them? And what's your experience then?
I went to a place, when I didn't know if I was gonna keep my job or not, and I was going through workman's comp. Well, it ended up, my boss was gonna fire me, so I knew it'd be a matter of time before I can continue my workman's comp check. So I tried it, I went to social services, and they told me where I can get help, Johnny Ruth Clark, so that's where I went, Johnny Ruth Clark. There's also a free clinic in downtown St. Pete and Sanderland Center clinic on 23rd Avenue South in St. Pete, and I've been to that one and Johnny Ruth Clark. But they have really good doctors in there, and I even took my son in there when I ended up with my son, who was 15. They have excellent care. They even wrote medicines for me that I didn't need because I had a lot of breathing issues from explosions that I went through from my job. So I am 100%. I do know that at Sanderland Center, even Johnny Lee Clark, if you have something major or you have to have some type of surgery, they will do it. And they will get a doctor for you to go ahead and do it. So, and that was years ago, but it still pertains to this day because I do keep in touch with those people down there. So it is pretty awesome. The hard part is when you go. That is the hardest part. It is to sit there. It's like an ER. You gotta wait to be seen. But they have occupational therapy. So for people that do need it. So you've got some really good ones in there.
Yeah.
So yeah, I recommend all those. There probably are more. I'm not sure where they're all at.
Yeah, we've had a lot of growth in that area of providers providing care to the community.
Yeah.
So there are a lot of great providers. I think again, if you're working with multiple different doctors at multiple different locations, it's really just about making sure that those doctors are talking to each other.
Exactly.
Because again, you don't want to get prescribed a medication in one location
Exactly.
and another location,
Exactly.
you know, just making sure
And
your care.
dental once a year, I think it's in February, dentists get together and they provide free dental care for anybody that can't afford dental care. And it's done usually in February. That's the time. Like the health clinics usually are in that information. So if you ladies don't know about it, you might maybe can ask your dentist about it. They probably do know about it. And but it's a real good program for people that otherwise would never get any dental care.
Is there anything you're worried about in the future with healthcare? You know, there's been a lot of, obviously, there's a lot of change and disruption in healthcare, of course, across every year, but is there anything you're particularly worried about right now in getting care, please?
The present administration, budget cuts. How's that gonna affect services with budget cuts with the current administration?
Anyone else? What keeps you up at night with your health? Nothing.
Okay, down, there's your-
I just read, and I'm not sure if this is true, but I just read that, all of our mental health information is going to be accessible by the government. And this applies to people that receive government aid, such as disability, SSI, housing vouchers, things such as that. And, therefore, if you receive any of those subsidies or whatever you want to call them, that the government can therefore have access to your medical and mental health information and take that information and do with it what they want, and then therefore make their own recommendations on your medical well-being. Have you heard anything on that?
There's a lot of information swirling around data exchange and how much data is shared with who. We, in our program, we don't share that data right now. It is against the law for us to share that data without permission of the person. And so we don't currently share any personally identifiable information on any service that we provide for the program. I can't speak to what other providers are doing or what other, but as our program and the funding that the county is providing to this program, we're not currently sharing that information with the federal government as part of any program of data exchange.
I watch a YouTube channel, the Disability Resolutions, and it's a lawyer from Walter Knott's, a lawyer from here in Florida. I think he's in Orlando or something, and he talks about it. From my recollection, because he does stuff every day, it's basically the stuff with the Social Security office. They're doing that now as part of a way to detect fraud, because that's how they're finding people who are like, somebody dies and then their checks are still getting cash and stuff, but they're not using any services or not going to the doctor and so that's part of what that's part.
Yeah, it's rare, but they make it sound a
Yeah.
lot more. Yeah. What else worries you right now? Are there any services that you wish our program offered that it didn't currently? I think we have a pretty good robust offering, but I'm sure we don't cover everything. I'm not, we're not that of an open pocketbook, but Oreo has something.
Some of those kind of services probably.
I second that. I have one at home. So, but I just wanted to say that, myself and my partner utilized your services several years ago, or 6, 8 years ago. And it seems as though your services have improved significantly and what you have to offer now. And I'm very happy to see that and that you're able to offer a lot of help for a lot more people. And I'm happy to see that you're doing so well. I think you're able to help so many more people.
It's been very tough since COVID. I mean, our program, the homeless program specifically served about 3,000 people a year within the homeless program, but post-COVID, we dropped to about just under 2,000, and it's been very slow kind of growing back up. So I know some of that is there's more access in the community in the past 5 years, things change. But we do want people to know that we are here if you need us. We are a safety net program. We are here to support the most vulnerable people in our community. And so if there is anything that you hear, see, or need, please let us know. Please, you've met and seen Anne Marie, our clinic staff. Please share that information with those that you're interacting with so that can feed up to us so that we can continue to improve our services or make changes to our program and our offerings that better meet your needs. And so, and also places we go. So if our MMU is not mobile the big van is not in the right place, or our street medicine team is not in the right place, tell us so we can make sure we get to where you are. We're really focused on getting to where you are, not you getting to where we are. We only have one clinic, one actual clinic, and we have 2 mobile vans. So we're doing our best to reach out to you more than you come to us. So, but please keep that line of communication open. Please let us know how else we can help and what else we can do to support you.
Anything specific my friend needs, he goes there.
Just ask him to call, call the phone number. Make sure he communicates his homeless status, like, that he's, and where he is. So I don't want that income limit or anything to be a barrier. Make sure to push that so that we can get.
That's the thing, I know more than anything, he needs meds and he's out of. Okay, it's because he doesn't have anything and it just nobody,
Or have him come talk to him, Marie.
thank you.
These people, if you want to speak, please ask for the microphone. We do want to record what you said.
Thank you, Gary. One more thing on enrollment. How long does it take to enroll once, if everyone's got the suitable documentation and whatnot?
If, do you know what, have you, like, in people coming in?
Okay, so it's fast. Okay.
If you do it online, it might take like till the next business day or
Okay,
two.
Sure.
For the home.
Yeah, that's what, okay. And then can I just be clear on the distinction between the Blue Card program and the healthcare for the homeless? It's 2 separate things.
It's 2 separate criteria for enrollment.
Right,
The services are the same.
beautiful. Okay, fine. Great stuff. So obviously someone has to be enrolled to use the benefits. So if I bump into someone in, say, downtown St. Pete who's injured or whatever, that's not going to be come your guys' way unless the person's gone through enroll. So the goal would be to enroll as many people as possible ahead of time. And then if said person had injured their leg in downtown or whatever, would they, if they couldn't get to you, could they call this number and someone would get to them, or have they got to physically get to you? You mentioned mobile units.
If it's an urgent injury like that, that is probably a hospital.
Sure.
type thing. So we're not an urgent
Got it.
care center
Yeah.
from
Okay.
that standpoint,
Yeah.
but we are, you can come. We do have walk-in appointment
Right.
on a daily basis. But we do get filled up too. So, that's where the waiting might come in. If, we try to, we try to get people seen the same day if we can.
Very helpful. Thank you.
Are you affiliated with social services on First Avenue?
Yes.
Okay, that's what I wanted to ask the question about that. So you are, but you're just in a different location.
We have our human services office. They do the enrollments at that office, but the van also comes to that office on Tuesdays.
Okay,
So we know that that's an area that meets the needs of the population right now. So
when I utilized all that, I had to pay back all my medical when I got my disability. I don't know if it's still set up that way, but that's what I had to do, and it was a lot of money that I had to pay back, a lot.
if you're enrolled with the,
I'm not
we don't
kidding.
take money. So I
Yeah.
don't know. If you're enrolled with our
Serious.
program, we don't. take
That's how
money
it
back.
used to be set up as social services. I'm not kidding, it was set up that way. Anything that you went through at social services, you would have to pay them back. Every bit of it, it automatically came from your check. Like, not just your attorney, but social services too, which I thought that was kind of weird. That I had to do that. Now, I'm hoping it's changed since then, but,
Yeah, we don't bill or even,
Well, that
but
sounds
no,
like,
that
like
is,
20 years ago?
yeah.
Cause I.
no, not 20 years ago.
Okay, I've been
No.
around about 10 years and
Yeah.
I've never heard of that.
I've been
Yeah,
here 10 years.
it is true.
No, if you're going to other medical providers that are not part of our program and you have bills with them, then yes, that could very well be the case. But if you came to the Bayside Health Clinic or you came to our Department of Health and got served, we don't keep track of anything you
If that
owe us.
when I was going through that.
It's $0
Yeah.
for zero. We don't,
Well, that's
we
good.
might know like what it might cost us to actually serve you, but
So-
we don't, it's not, it doesn't go to
So
you.
how are
ever.
you getting your funding? Are people donating?
It's a
People
great
are just donating.
Yes, we get, our healthcare for the homeless program is
Okay.
funded by Pinellas County government,
Okay,
is the primary source.
okay,
We get funding from the federal government, from Health and Human Services
Okay.
for the homeless program.
okay.
Those are the 2 primary sources. If you do have Medicaid, we may get some reimbursement. I think, I say
Yeah.
$1,000 a year, maybe
Right.
reimbursement, but our program is about a $5 million program.
Okay,
For
good.
the 2,000 people. So, but it is primarily coming from
Okay,
general fund tax revenue from the
Right.
county.
okay, thank you.
The other thing I'll piggyback on that is, disability advocacy was mentioned. And for those, what that means is helping you apply for Social Security disability. And those are for any blue card eligible, Pinellas County Health Plan, individual that's enrolled. The reason I mention that is because they do not keep a portion like many of your attorney fees and things like that. So they're gonna look at the case and say, does this case stand a chance? If not, we're not gonna proceed. We're not gonna waste anyone's time. And then if it does proceed, they have direct connection with Social Security office and different things like that, and have awarded, I think, over $500,000 within this calendar year of disability. So just, that's a program there. There's a special kind of enrollment class at Bayside that happens. I don't know the frequency of that, and then out of the St. Pete office.
Yeah, so we have many teams that come out to our building at Bayside. So disability comes twice a month, every other Friday, basically. They will be there this Friday, actually, tomorrow. And then, yeah, we have Bay Area Legal Services that comes out once a month. They're there to answer any legal questions that any of our clients may have. No questions asked. There's no worry about talking about your situation. We also have a vision screening that comes out once a month. We have various, vaccine outreach and testing outreach where it's like HIV and stuff like that. So we do try to provide a comprehensive healthcare, meet you where you're at and get you everything you need.
By taking a significant amount of your time. So I do thank you. I appreciate your feedback and your input. And again, please let us know. But we're really open ears. And I really want to hear what else we could be doing to support you. Thank you.
All right, I'll ask, do we still have maybe 5 more minutes or no? Or do we need to move on?
We still have time.
Okay, all right, you guys are good to go. You don't have to stick around. I went into the lobby because I was curious what
Thank you,
homeless
ladies.
resources were here.
Very good to see you.
Yes, great job.
Very good to see you. It's been a minute.
So I went into the lobby to see what resources were there, and they're really depleted. I know this is a really active library location.
We don't keep them in the lobby.
What?
All the resource information is inside the library.
Yes.
Pass the information down.
Yes.
There's a whole table.
I couldn't find that much, and I asked 3 librarians.
Maybe, what do you have?
But this is the one I wanted to talk about real quick. It's hurricane season. Y'all know that. It's mid-September. It's serious time right now. Honestly, I think it's 8 years since Irma yesterday. Adalia, Ian, Helene, all of that over these past few years. So I just wanted to make sure that you guys have all seen this card. You all are aware that it is prime time hurricane season. I found a bunch of these in the library. If you have any special needs, if you have difficulty getting up and down off the ground, if you have electric dependent material like a scooter, if you have insulin, if you use a nebulizer, breathing machine, any of those sort of oxygen, if you're on dialysis, any of those sort of medical needs, make sure you're registered for a special needs shelter. So special needs shelter does require a separate registration, and they will also help coordinate your transportation if you need it. Okay, so I didn't want to just do a plug for that. We're not going to have a storm this year, but this is prime time, so I just wanted to mention that.
Thank you.
Thank you. Sorry.
You'll see us at the shelters tomorrow.
And yes, well, all 3 of us will be at the shelter.
No shelters this year.
No
It was in place last year.
That would be great. Yeah, but it's really rare. Last year it was Thursday. All the way around.
Has everyone had a chance to maybe take a peek at the consent agenda? Anything we need to know? Anybody want to table something for another time? Make any corrections? Add anything?
I got one small thing.
There is a new food service opening. It's on Tyrone. It's by the Windward Church. Right now they have a Monday morning brunch. They have free clothes closet. They have a full meal, home cooked stuff. I went there Monday on their grand opening and I had the actual real deal biscuits and gravy. I mean, with biscuits in it, it was awesome. I had 3 plates. I mean, fed myself. But they welcome me to come out and check it out, and be more than happy to have everybody come on by. It's 1 block past the hump on Tyrone Boulevard on the right-hand side. They have a large sign out there. You can't miss it.
Okay, well, I guess that takes care of our resource sharing for this evening. Anybody? Anything we want to add?
Would anyone like to motion to approve the consent agenda, which had last month's minutes? Or should we wait for more review and then approve it next month? Oh. That's why I was trying not to vote that. Okay. It looks like for next calcium is from your analysis, right? And well, it's what's up solve. Maybe lots of our goals and you know,
We have a quorum, Jen?
We have 12?
I think we do.
We need to vote.
Motion to approve?
I motion to approve.
Second?
Second.
All those in favor? Thank you, ladies.
Thank you.
Bye, ladies. Nice to meet you. Bye-bye.
Any nays?
We'll make a motion.
Jennifer
And then Derek.
thank you.
Motion approved. You want to talk about the initiative?
Sure, I don't have much. Yeah.
You're up, Ms. Beckman.
I didn't, I worked on it. Help it, it was so. Advocacy initiative. All right, here we are. All right, so happy Thursday. I'm glad to see we got a full house tonight. Just wanted to, we'll take a minute to, I hope you enjoyed the brownies. And they're here to celebrate Megan's last meeting with us. So there's a card going around. If you haven't signed it yet, please do if you'd like to. But certainly we appreciate all that Megan's done over the last few years, and we're gonna miss her. We're really gonna miss her, you know, but we wish her well, and she's moving out of state, heading north. Do you want to say a few words about where you're going? And yeah.
Oh, wow, you guys are just, you make me feel so special. It's been such a pleasure to work with such an engaged group of community members that care so much about the mission of ending homelessness in Pinellas County. I swear, like,
This is like the most consistent group meeting we
largest.
have, and the largest, like, you all should be so proud of yourselves, like, the law, interactions with law enforcement pamphlet, that is awesome. That's at all the providers, and at COC, that's in their lobbies. I hand that out at all of our meetings. And you guys, that was driven by Ms. Cat here, and very proud about that. Jennifer's on the advocacy committee. But it's really good to see everyone involved. And I will be rooting for you from far away, because I'm going to Vermont. I'm moving next week. I'm moving. I do understand that it's cold, yes.
Really cold.
But it's a good move for us. So, thank you again, and thank you, Kathleen, for the sheet cake. It is delicious. It was not expected, so thank you. And I will.
Thank you, Megan. Okay, so next on the agenda is this advocacy initiative where we started the storytelling last week or last month. And if anyone wasn't here last month or didn't get a notebook, I have extra notebooks that, I have purchased quite a few, but if you need a notebook, anybody need a notebook or want another? Okay, what, you want a color? You can choose a color. But I had sent a couple of emails. So I taught high school English, and certainly I know on Sunday nights, a lot of times kids do their homework frantically for Monday. And sometimes they don't get it in, and things happen. So I sent a couple of emails to remind you, like, if you are working on it, that'd be great. I hope you did. I worked on a piece because I always feel it's important to contribute and do some of the work along with a class or peers or partners in this group. So I wrote like 9 sentences. They don't rhyme. It's not a poem. It's just kind of more of a statement. Yeah, I mean, I thought, and before I can read it, I don't have a problem reading it. Some people don't want to share theirs. That's fine. Y'all have my email. If I emailed you and sent that reminder and you got it, if you'd like to share something with me for the next meeting or something, feel free and I can give you some feedback. If you'd like to partner with somebody in here for the remainder of our time or for a few minutes, I guess we're the last thing besides closing. So we could have a few minutes if people want to, if you think you want to partner with someone. If it's something that you'd like to participate, but you don't want to do a whole piece on your own. Remember, we talked about no more than 2 or 3 minutes so that we could use something like this to read before a council meeting if we wanted, or to submit to the Tampa Bay Times. Not next week, the week after, I will be in front of all of the elected officials who show up. And let me tell you, they don't all show up. But the Pinellas County elected state officials, so our representative senator, at the Clearwater East Library auditorium. So that's in corner of Drew and like 19 on the SBC campus. So they'll be there. I think it starts at 9 in the morning, maybe 9:30. And anybody any one of their constituents, any one of their voters, the people who live in Pinellas County could sign up to speak to them about something that they cared about. And so you had to like sign up like immediately. So I signed up and I'll be speaking as chair of the COC and talking about, please don't cut our funding. Essentially, that's what I get for two minutes or so. Sherry's working with me on, shaping what we're gonna say. Yeah.
That's campus across from the Phillies Park.
Yes, it is. Yep. And so that would be, if you were able to sign up, or if you wanted to attend and hear what people are saying to the elected officials at the state level, what's important, come join me and sit in the audience and listen. It goes on for like 3 or 4 hours, I think. But it's fascinating to hear what people talk about. Some people talk about, I don't want greyhound racing. I don't want the bear hunt. I don't want you to, paint over intersections. We need more housing, all sorts of things that they talk about. Time.
What time is it?
Oh, I think it's like 9 or 9:30. I'll send out an email to this whole group in the morning. Yep, I'll send out an email to this group and remind you if you want to attend. Because the press is there probably. And so if there's if there's a TV station, maybe, you want to go up to them and say, yeah, I didn't get a chance to sign up, but here's what I would say. Tell them what you want to say. But anyway, this goes to talk about the reason we're doing this storytelling is so that you have something real concise, meaningful to you. It doesn't have to be you pouring out your heart and all of your intimate experiences. It can be what you know about homelessness because you've experienced it or you know people who have. So it can be a compilation. And anyway, that's just an overview of what we're doing. Does anybody have any feedback or comments about what they worked on or how it went, or do you want to share? You worked on it? Good. I know we talked about some possible titles. Yeah, Jennifer.
I don't mind sharing.
Oh,
I
fantastic.
actually.
And then I'll share mine. You want to share yours first?
I'll share.
All right. Thank you. Loud and strong, loud and proud.
Actually, this was like, I wrote this, for the application for the LEAC, of like why you wanted to be a part of it. And, so it starts out, I am a survivor of severe childhood trauma and narcissistic family abuse. I decided in July of 2021 that living in my car to get away from toxic people was a good way to start a new life. I left my hometown in North Carolina and to start my journey to healing. I also suffer from chronic back pain and made my way to Clearwater to live out my life in a warm climate. I arrived August 6th of 21 and started looking for places to live. I called 211 and was told I could go to Safe Harbor, where I was treated like I was trash. In October, I started my own petition for the treatment I received. While frequenting hot meal feedings, I met a remarkable woman, and she encouraged me to take it to the city council in Clearwater. I started going to meetings and spoke up about my story and the lack of safe shelters, lack of affordable housing, need for more mental health services, and empathy/trauma training for law enforcement and government officials. I've been a part of the LEAC committee, Lived Experience Advisory Committee, since its inception. I would like to continue to be a part of making change in the community, work with community leaders to change the stigma and humanizing the homeless by getting their stories out to citizens that look down on them without knowing how they became homeless. Also advocate for more funding to more shelters, mental health services, other resources, and affordable housing.
And you do an amazing job speaking before government officials.
And I jumped in the right summer.
That's all right. All good. All good. So here's the one I wrote. Again, as I told y'all in my email, it's like, it's just 9 sentences. So it's, I didn't put a title on it. The streets in Pinellas shimmer with sunlight, but for too many that light is harsh, relentless, burning down on those without shelter. Rents climb higher and higher. Wages remain stagnant. And as opportunities dwindle, wait lists get longer and longer. Call a number and get in line for an hours-long wait. I see people moving from bus bench to church doorway, behind the 7-Eleven, at a busy intersection, carrying all they have, weighed down not only by bags, but by a system that does not open its doors. I walk past and feel my heart pulled taut. Empathy is not enough, yet it is what I carry. I cannot hand out homes, cannot promise steady pay. I cannot silence thunder rolling across a thin blanket on a cold night. But I can listen, I can speak, I can hold conversations that matter. Because silence too is a kind of abandonment. In these moments, I know the struggle is larger than one person's reach, but not beyond many voices joined Here in Pinellas, where the Gulf meets the sky, I remind myself that compassion is the first stone laid on the path toward shelter, dignity, and change, but that compassion must be followed by action always. Anybody next? Did you?
I didn't go that far with mine, because, when I was homeless, I was very lonely and very sad, and I kind of went off at this here. But what you don't see about me is I do care about people. I just care, like she said, I have a community, I have a be. Like even people you don't even know, and you hear something happen, like, oh my God, that's just sad. But I do care, and good news was I made it through my homelessness. Is it easy? No, even when you land on your feet, it's still hard. It's still can be hard, like it is for me, in fact. And what I want for everybody here is hope for a better future and a better day, even for myself. That's what I want. When I see, all of us here are working basically together, which is great. I love that. And I just feel like it takes a village. And we're the village right here. And passing those telephone numbers, things like that. And I don't feel alone anymore. So that's like the biggest blessing of it all. And those women coming in here made a big positive impact. I'm gonna miss Jennifer, Megan. I hope you stay. And but we're gonna miss some of the people here, and even Victoria's gone, so I don't wanna cry.
Anybody else have a start? Anything they want to share? Norm, anything? No, not tonight. That's okay. Mary? Rose?
And one,
Okay.
I just want to mention that, when it comes to this kind of stuff, I kind of have the same problem that he has. As far as all my information is up here, I can do this and I can talk like this for hours, but getting it from here onto a piece of paper is like learning Chinese. So the only thing that I can say is that you and I need to like make a date together or something, and I need some help to be able to do that, to get it from here onto the paper. So we can go on the radio or whatever we need to do. I need the help. That was the one thing when I took my GED test and stuff, I couldn't do.
we can
We'll
make
figure
that
something
happen.
out.
Anyone else?
Okay, if anybody wants to, again, I'll make this offer and, but if you wanna email me anything for feedback, I can do that. If you wanna email me just a sentence or two, you don't even have to, and say, I don't want my name on it. We can put together kind of a LEAC statement. I would hate to, we don't have to call it a poem, but a LEAC I don't know, what would we call it? A LEAC description, a LEAC portrait. What do you think, Sherry?
Like just even snapshots of, or, vignettes.
Yes.
And
Yes.
they can have first names or no names.
Right, or no name, or initials, or whatever.
initials.
And we can figure out a creative way to put it together, even an artistic poster, just pieces of statements and words. It's called a word splash, where you put your words in and it comes out. There are lots of ways we can do that. So I don't want to belabor this and, set aside time, at the next meeting, unless you want to, but why don't you send some things my way if you'd like? And again, I'll send you one or two reminders, and otherwise we'll just leave it right now where it is, unless there's some continued interest or engagement. But yeah, I think, we're on a start. Sherry and I we're going to talk to retired Pinellas educators and employees of Pinellas County Schools on Monday and give them information about the PIT report and the numbers of children that are experiencing homelessness, and a call to action to help us on the PIT count in January. And then the following week will be on a radio show. Jennifer might be there if she wants, and to talk about that PIT report too. It's real condensed, that radio show. So we're out there talking about experiences and a kind of a call to action and some help. Yeah.
Reiterate what I said, that's also the reason why it needs them out, because without it, I'll end up with a diatribe that's a mile long.
Here's what I would suggest to you and anybody. If you have a phone that will allow you to dictate, to just speak to text, voice to text, put it all in there and then copy and paste it and send it to me. And then I can start to edit and, you know, organize it for you in a way. But if you can get it all out and now we've got a pile of your verbal story, then we can shape it and condense it.
I already kind of got something like that. The problem is it's diatribe.
That's okay. Send it. You can send it my way.
In the Play Store house, there's a speak to text app. It's really good.
Yeah.
You just speak to it and it'll all go into a text. You can take the whole text and just send it to her.
Yeah, no, I've done that.
She can edit it for you.
Yeah, I use my memo or note app and
Yeah.
stuff. It's a diatribe a mile long. That's why when somebody's done, it's like, who the hell did you piss off?
Oh.
Every time I tell a story, that's what I hear.
Because he wants help, but I feel like there are some other people here that aren't speaking up about it. But, does anybody have any suggestions on how we can? Like, I know Jack, so, he did write something, but he did finish it. So, that might be the same for some other people here today. But does anybody have any ideas on how we can all, you know, get that out, just except for just a few people? I mean, I know I will, I know he asked for help, and I'm guessing maybe there's some more here that would like to say those excellent. Yes.
Yeah.
So as everyone's sharing this kind of wonderful stories, like you said, there's audiences, radio shows, council meetings where you're going to stand up and vocalize. That's where those type of things. And as you said, graphic or design, what immediately comes to my mind is all these wonderful people in this room, all faces, right? And we've all got a one-liner up here about our success and why you're here, right? You just pick some from you and mine today. And we've all got challenges and barriers together. So what I'm kind of seeing is almost, it's great for speaking, but what about like a reference guide, poster, graphic that has, each person has a profile picture or whatever, doing by a tree, a family photo, a personal photo, a good, a bad one, whatever, it doesn't matter. A one-line statement, and then, you know, what's worked, successes and what the barriers were. So you can kind of tell a 3-minute story in one thing in 10 bullets. So some of it's good for radio interviews, and that's more of a, hey, we can pass this on about your committee to A, and you get a snapshot in less than 2 or 3 minutes about a story of every member.
Megan, you got an idea? Yes.
I do know a few people that are involved in literature, journals, printing, things like that. Magazines, I don't know if you've heard of the Zine Fest that they have in St. Pete, I think, every year. So that could be a platform or a format to showcase these stories as well. So I can look into that and see if there's any interest in featuring these great stories.
Thank you. All right, so we won't put it on the October meeting, right? We'll wait and see if anything comes back. And maybe what I'll do is design some kind of I was thinking like a poster that says, you know, words of wisdom from lived experience or something. And then it could just be a sentence. It could be a phrase. And what we could do is I can get like butcher paper and we can all just write it. Y'all can just write it. And then we'll figure out how to make it pretty and then how to use it as a one pager for people. Yeah. The other thing I was going to mention, and Sherry and I talked about this briefly at Gary was there and Michael was there too at our last board of directors meeting, which was on Friday, is that, and I think you guys are aware because you brought it up, money is tight and cuts are happening at the federal level. Groups are being penalized if they prioritize housing first, all sorts of scary things going on. And so, you know, as chair of the COC, I just want to make you aware that we are looking at ways to tighten the budget. I put out a plea and appeal for our board of director members to contribute to the Lived Experience Advisory Committee to help with your pay and incentives. And so that, those might have to be modified slightly. So nothing's been talked about or decided, but it's just, I just don't want to blindside anybody. So I just want to make you informed that those are conversations that are probably going to be happening. Yep. Yeah, Gary.
Yes, due to the, as we know, with the present administration cutting funding, we're gonna get creative to make sure that we can keep up with the slip ends and the other as well. We've appealed to the board of directors to make a physical contribution to the LEAC, so that way to keep up with the strip end cards and such. So there will be some changes, but you will be definitely kept in the loop.
Yes, that's something we did talk about, but one of the things I think we're going to like to do is with the story, to create compelling stories to present, either anonymously or with your name to people in power. Just personalize this, that you're not just a line item, not just something in the budget that can be cut or backtracked, because this administration wants to backtrack on basically make it almost impossible to get new funding. And which is wrong, of course, but we have to deal with it for the next year, 2 years, or 3 years, or whatever. Well, the point is that we need to make sure that people in power know that what they do to eliminate funding or decrease it has an effect on you here at the front lines. So it may seem like homework, but it really is something to help you in the long term, to have your story presented in a good, positive light. Because those in power do not believe that you can't be homeless and not be a drug addict or alcoholic. Stupid. Yeah. So having your story told in a way that's positive, does not perpetuate the stereotypes that they have in their mind, is going to help us in the long run. So that is one of the real good reasons why your story matters.
Okay. If I could have.
I'm just gonna second what you said, because that's the old adage goes, nobody, they don't care until it happens to them or somebody that they care about. Until you walk in a mile in somebody's shoes like one of ours, they have no idea.
All right, everybody,
Okay, so I heard what you both said, but the thing is, if you don't speak up and like in our group, maybe to these other people that you're talking about, I have no problems with that, because you know what? Maybe it takes just that to speak up and just have the guts to go ahead and tell them how you feel. You know what I mean?
Well, you put a face on it, it makes a difference. And Jennifer will tell you, when you stand up, when she stood up in that podium, it was like you could hear a pin drop. And I know she was nervous, but she did a great job. And I see there that you've got that handout that has the different stories. So we've done something similar, but we don't have to have anybody's picture unless you decide you want to. But it would certainly be created by this committee, not by somebody else.
This out is
Yep.
like a.
Yep.
Idea.
and after all, people, why did we join this committee? We wanted our voice heard. So now is the chance to speak up. We want our voice heard. We need to be the voice of the homeless to be heard, so that's why we're here. You want Mike, you want Nick? Okay.
I just wanted to offer, in addition to Kathleen offering help, that if I'm happy to help anyone think through their stories, I do this a lot as an organizer. I'm gonna have to run out right after the meeting, but I'll leave a bunch of business cards that have my cell phone number if anybody needs to reach me.
Okay, everybody, as we all know, Megan is moving on to better opportunities and such. And I'm sure we all appreciate her for all her hard work. We're not the easiest group to work with, and she's been very kind, and I for one have realized how hard these girls work, and they really do. So we thought of you. And we will miss you greatly.
Thank you.
All at the same time, we also appreciate Ms. Beckman and all her patience and her hard work.
Everybody.
And we wish you the best of luck.
Thanks. You will be missed.
She will very.
I just said you will truly, truly be missed.
Yes, absolutely.
Yeah, any announcement, Sherry, on who might be our liaison for the week?
We do have a couple of people, there's one person that I really think should do it and it'd be fantastic. And I won't say his name just yet because I know many of you know him. So I don't want to throw him under the bus today.
Okay.
But we do, and we will be able to continue, of course, support. But Megan, you have been just phenomenal. And we started a week apart and came up together in a year. It's wild. It's wild. And but she just very thick, and she has done so much work that I don't think doesn't get seen. I know it, but it matters and it gets felt for sure. And I'm going to miss you. And we are not necessarily, she's not done with us. We don't allow divorces in this family. She has to, she's still gonna be in touch and we may still have some more opportunities, even in Vermont.
Everybody, we can give the little lady a round of applause.
Everybody, before we end today, I just wanted to point out at the end of the agenda, we have invitation to future COC meetings. And I put links to our community events calendar and the COC meeting calendar. And you are all encouraged to join the PIT Planning Committee, which is in full swing. Subcommittees are being created right now. And we need everybody's help to make next year's event successful. So we can advocate for more funding and services in Pinellas County to help end the homelessness. So if anybody is interested in PIT, that's point in time count, where we go out and survey everybody that is unhoused on the day in January, please let Sherry know, okay?
All right. I'm sorry it was late. I'm coming in today. We did have a lot of good information about healthcare and it's available for us all. Really got some new classes myself through Vision Florida through helping out with soul care. And I'm happy for that. And in addition to that, I just want to reemphasize that if you can do the story next month, if it's just a couple lines, is all be helpful. And yes, planning for the pit for next year will be important as well. Because of the issues that are involved in the state, and we want to make sure everybody is counted. Other than that, I think we covered a lot this meeting. We do appreciate everybody coming out. We hope to continue with that in the next coming months. So be out there, be safe, because we are in the middle of hurricane season. It's slow so far, but this is Florida. Anything can happen. Other than that, there's nothing else. People adjourn it, close the meeting for September, and we see you all in October.